name is Israel Bimpe, and I'm a pharmacist. Until recently, I was in charge of integrating Zipline into different health systems. I had previously led the integration of Zipline into the Rwandan health system, and then I took on leading that for the company more globally. But now I'm in charge of global health partnerships with multilateral organizations. So it's organizations such as Gavi, Global Fund, and UN organizations. And I make sure that we collaborate with them to be able to advance their mission, whether it's to increase access to vaccines, eliminate AIDS, HIV, and TB, or any other disease or any other campaign that we could try and participate in. I think that's something that we are noticing a lot, and it's, a lot of people will directly think about the fact that, drone can allow fast delivery, for example, or they can allow delivery when there is a lockdown and physical distancing mechanisms in place. But if you think a bit beyond that, it's just that drones are actually the best answer to many of the problems that we're facing with this pandemic and maybe than other pandemics. The first thing is there are very, very few and very scarce resources, and we need to ration them and distribute them where they are needed exactly. However, those resources are also needed really fast when they need to be needed. When there is a case of COVID somewhere, the resources are really needed very fast. So you have on one hand the problem where there is no possibility to stockpile throughout the country at every health facility, but still there is that urgency. And that's where you can see that, a solution like Zipline and the drone, when designed into a health system, can allow that fast response. That's the first aspect. The second aspect is continuity of care. There is lockdown, there is diminution of activity, people are no longer moving around. But people are still taking medicines, people still need to get vaccinated, some people still need to take their chronic disease medicines. So drones can also unlock something there where we ensure continuity of care, regardless of what's going on with response mechanisms being put in place. And so that could be either by restocking health facilities or by even delivering directly to the patient's home. And so Zipline in particular, we are doing different solutions currently. In Ghana, for example, we are stocking and delivering personal protective equipment for all the facilities that we serve. So the government gave us their stock, and they usually tell us, please deliver this here, this there, depending on the need and what's going on. Then there are also some preventive, protective equipment that we've been delivering, like thermometers and hand sanitizers to different health facilities. Still in Ghana, we are also delivering test samples. So that's another thing that drones would have, right? One of the best things with this pandemic is that you have to test really fast and really efficiently to be able to continue contact tracing and be able to make sure that you are doing your work really fast. So what we are allowing, where we are based in Ghana and Rwanda, health facilities are usually in rural areas. And they have, and testing facilities will probably be only one or two of them in the whole country. In case of Ghana, there is only 2 testing facilities in the 2 largest cities. In both, it takes long to get back the results. Secondly, it just like they cannot make it more efficiently because they have to wait to have 200 tests to make the trip worthwhile and so on and so forth. And so what we are allowing them is they are just bringing it to Zipline. Either it's a dozen of tests, 20 tests, 5 tests, any number that they can collect at that time, and then we fly it into the city. Then they receive back their results fast enough via message, email, or any other communication mechanism, and then they can continue implementing other prevention mechanisms in both at the hospital but also in the communities. In particular, here in Rwanda, we are ensuring continuity of care. So a lot of cancer patients who were supposed to be traveling to the only cancer center in the country are now receiving their medication directly from Zipline without having to travel. And so we are also working with hospitals so that they can do some form of telemedicine-based testing so that they can still receive some form of care or diagnosis before renewing their prescription, but we are sending to them prescription directly. And we are very much hoping to launch operations in the US in the next month or so, where we could be able to also just apply the same experiences to respond to COVID spread in the US. So it's interesting developments that are there, and that's where we're seeing that, a drone-based solution shouldn't be a silo, and that's what Zipline has always tried to do. We are very much part of a health system, and we should be seen as such, and we should be engaged by all health stakeholders to be able to add value in that capacity. But I think to the public, I will probably just reinforce the need to really be vigilant in terms of protection and protecting others around us by observing all the advices that we are getting from public workers and different public healthcare leaders. But I also want to emphasize on the fact that this is a new era. We are ushering into a completely new way of looking at things. We are going to be transformed as significant as the First and Second World War transformed us, as much as the 1918 influenza pandemic changed us. And so it's really a time to reckon with, I think I will use an article that I recently read, which talked about the time to build. It was published by Mark Anderson of A16Z. And he was telling that we knew these problems would come, but we never took time to build the solutions. We didn't build enough manufacturing plants to making PPEs. We didn't build healthcare systems that can really take on this type of challenges. We didn't build vaccination capabilities. We don't have enough antibiotics. So I really think this is a time to reckon with the need that everyone, wherever they are, should really think of how do we collectively start building with the ability to never have to face this and be able to address it heads-on when we face something similar, both from a public health perspective, from an economic perspective, and in any other perspective that's needed.